Hello, everyone. My name is Kevin Rohr, and I am a certified addictions counselor in the state of Florida under the Florida Certification Board. In this presentation, I represent a treatment center that specializes in treating gambling disorders. This treatment center is called a Pathway to Recovery. We provide effective and evidence-based treatment modalities to those struggling with a gambling addiction. Pathological gambling is an impulse control disorder which is driven by pleasure, arousal, and gratification. The term pathological gambling will be used interchangeably with the term gambling disorder throughout this presentation. Now, this is not to be confused with problem gambling. I will discuss this more in depth further along in the presentation. Gambling has become more accessible, convenient, and widely advertised across the globe. There are limited resources for treating a gambling disorder, including quality inpatient treatment programs. Plus, there is poor empirical data and successful outcomes related to community-based 12-step meetings like Gamblers Anonymous without being joined with a clinical treatment program. This presentation will mainly focus on discussing a primary treatment program for treating individuals with a gambling disorder, what pathological gambling is, and what criteria need to be met in order for a diagnosis to be made. As this presentation progresses, you will hear about the diagnoses for pathological gambling, how gambling presents itself in today's society, information on our treatment center, evidence-based strategies for treating individuals with a gambling disorder, and continuing care treatments that follow the primary episode of treatment. With all that being said, I am the clinical director of a Pathway to Recovery Addiction Treatment Center for Gambling. I will be providing information today to families who have a loved one diagnosed with a gambling disorder and who are seeking treatment for their loved ones. Gambling has become more and more popular as technology has advanced over the years. Gambling can easily be accessed on any smartphone at any time and anywhere. It is no longer necessary to visit a casino or arcade to gamble. This has only exacerbated the wide range of issues that gambling places on individuals and your loved ones. The need for effective treatment for gambling disorders has remained relatively low compared to the increased numbers of individuals with severe issues related to their gambling. These issues involve personal, familial, financial, social, and occupational areas of life. So, what is pathological gambling and how is it different than just problem gambling? Many individuals who gamble start off as a problem gambler but progress to having a diagnosable disorder and meet the criteria for pathological gambling. Problem gambling is considered when an individual who gambles experiences less than 5 of the following criteria. 1. Preoccupied and frequent thoughts about gambling. 2. Increased tolerance and placing larger wagers to experience the desired excitement or rush. 3. Experiencing withdrawal symptoms with feelings of restlessness or irritability when attempting to reduce gambling. 4. Seeking to escape from problems in life or increase their mood. 5. Chasing past losses in order to recoup money with more gambling. 6. Lying to friends, family, therapists, or employers about the extent of their gambling. 7. Loss of control after unsuccessful attempts to reduce their gambling. 8. Engaging in illegal acts to gain more money to gamble or to recover previous losses. 9. continued gambling after losing employment, relationships, or other significant opportunities, and 10, turning to family, friends, or other parties for financial assistance due to their gambling. Again, an individual is only considered a problem gambler if they experience less than 5 of the stated criteria. Pathological gambling is considered when an individual experiences 5 or more of these criteria, and these criteria do not coincide with a manic episode. So pathological gambling is highly comorbid, meaning that at least one other mental health disorder is present in an individual with a gambling disorder. Many of those with a diagnosed gambling disorder have a primary diagnosis of a major depressive disorder, anxiety disorder, other affective disorders like bipolar spectrum disorder, or obsessive compulsive disorder. Other disorders like attention deficit hyperactivity disorder or a substance use disorder. These disorders are often exacerbated, as I previously mentioned earlier in the presentation, with a wide range of issues gambling can cause. An alarming statistic is that as much as 17 to 24% of gamblers attempt suicide. This is a lot of overwhelming information, so let's move on to treating your loved one with a gambling disorder. You will now see a flyer for our treatment center. And the evidence-based treatment modalities that we implement into our specialized program. Both individual and group psychotherapy are involved. When your loved one is in the depths of their addiction, they feel alone and isolated. Group therapy offers them a chance to see that they are not alone in their struggles and have the ability to relate and identify with others who have the same struggles. In the midst of treatment and when healing begins, group members hold each other accountable and challenge each other's irrational thoughts and beliefs. During our individual and group therapy sessions, motivational interviewing, cognitive behavioral therapy, and psychotherapeutic methods are utilized, which can include cognitive restructuring, breaking through denial, evoking change, identifying the reasons behind their gambling, and interrupting the addictive cycle. Your loved one will also be encouraged to attend Gamblers Anonymous or GA meetings, where self-help groups are met with community support. Evidence shows that coupled with professional therapy, regular attendance in GA meetings have multiplied successful outcomes. Outside of community-based 12-step meetings like GA, your loved one will be involved in a regular gender-specific group therapy session. Studies have shown that men who gamble often don't seek therapy for upwards of 20 to 30 years after the onset of their gambling, which generally begins in adolescence. As for women, gambling usually presents itself later in life and treatment is sought within 3 years. And in many cases, depression is present in more women gamblers than in men. You will also see some standard amenities we provide to complement our clinical services, such as recreation, which includes several outdoor activities like hiking, bicycling, and kayaking, along with holistic wellness practices like yoga, mindfulness, and practicing a healthy diet. So after the primary episode of treatment is completed, we clinically recommend continuing care services, which can include outpatient individual and group therapy sessions, monthly appointments with a psychiatrist, and pharmacotherapies to manage prescribed medications, along with continued regular attendance in community GEA meetings. You as a family member will also be encouraged to attend Gamma-Non meetings, where loved ones like yourselves can find support from others who shared similar struggles with their addicted family members. It is our hope at A Pathway to Recovery that you too can recover as your loved one overcomes their gambling addiction. Thank you for listening.